cervical laminoplasty. It means changing the shape of the lamina, which makes more room for the spinal cord and the nerves. It's a posterior approach, which means we go in the back. Basically what we do is make an incision right down the middle, pull the muscle back, and then under the microscope, we cut the lamina. The lamina is this arch of bone in the back. We cut the lamina all the way through on one side, halfway through on the other side, and then open it up, saving that halfway through side as a buffer and as a bridge. Then in the open side, we use little metal plates with some tiny screws to keep the bone open. And so by opening up the lamina, it makes more room for the spinal cord. Reasons to do the surgery is it takes pressure off the spinal cord. So if you have stenosis and myelopathy, which is dysfunction of the spinal cord, making more room for the cord can preserve the function and even allow it to recover. How do you know if you have this? Well, you need to see a physician to be examined, obviously. But some of the findings are clumsiness of your fingers, loss of fine motor control, difficulty doing buttons, and a balance disturbance where you're unable to walk heel to toe in a straight line. Those are findings of myelopathy. So the cervical laminoplasty, the surgery typically takes 3 to 4 hours, depending on how many levels we do. Most people stay in the hospital for 1 or 2 nights. It's a safe surgery because we're not manipulating the spinal cord. We're basically working on the bones around the cord, opening up the bones, creating more room. There's still a risk with any surgery. With the laminoplasty, there is a risk of spinal cord injury. This surgery, by relieving the pressure, can actually interrupt blood supply to the spinal cord, and there's always a risk of paralysis or neurologic loss from the surgery. But overall, it's a very safe and reliable surgery. Some people can get neck pain after the surgery from doing the surgery and the muscle dissection and the instrumentation. The alternative to the laminoplasty is a fusion typically. We typically do fusions from the front, where we go in and fuse 2 or 3 or 4 levels from the front, which is a very safe, reliable surgery as well. The downside to the fusion is if the more levels you fuse, the higher the chance bone doesn't actually grow and you don't get a successful fusion, and you get a failed fusion or a non-union that may have to then be fixed by going in the back and putting in screws and rods in the back. So the fusion has 2 main downsides. One is the bone may not grow, may not get a fusion. Number 2 is it stops the motion of whatever segments you fuse. Here's a fusion with a plate on the front. These aren't going to move anymore. That can put more stress on the discs above and below, which can accelerate the wear and tear already happening at those. You can develop a problem at the next level. The laminoplasty doesn't fuse it. So we crack the bones, open them up, but we're not fusing across the joints. The instrumentation, the plates we put in there, go just on the one lamina. It doesn't cross the laminas, so it doesn't stop motion in between the vertebra. Therefore, it preserves motion, which puts less stress on the discs above and below. So compared to a fusion, fusions can more reliably treat nerve pain down the arm and can also treat neck pain from degeneration. The laminoplasty, the benefit is it preserves motion for less problems at other levels, but you may have neck pain from the surgery, and it may not treat an individual pinched nerve as effectively as the fusion. Both good options. One other consideration we take into account is the alignment. If somebody's neck is kyphotic, which means bent forward and collapsed down, we're probably going to recommend a fusion because we go in the front and open it back up and restore the alignment. So if you're interested in us potentially helping you for this type of complicated case, coming in to see us in person is the most reliable and effective. You're welcome to call 310-448-7890 for an appointment, or you can email us at info@watkinsspine.com. Thank you.